we'll wait a minute and then start. Hi everyone, thank you for joining us for today's dental shadowing session. We wanted to remind you that in order to get your hours, you'll have to take a quiz at the end of the session, and as long as you get a 3 out of 5, you earn your hours. The quiz will be linked to our link tree, which is in our Instagram bio. All right, let's get started. We are very fortunate to have Dr. Landon Oka for today's session. I am handing the mic to you. Get started whenever you
Cool. What's up, everybody? I'm Dr. Landon Oka. I'm a general dentist out in Hawaii. Let's go to this page. So this is me. I got my undergraduate degree in biomedical science from Oregon State University. And my VDS degree, I went to Indiana University. And I'm currently practicing in Mililani on the island of Oahu. And I also do 2 days a week in IA as well. So that's my background info. So study tips, advice on studying, staying motivated. Basically, study tip wise is, you got to really just find what works best for you. For me, it was a lot of repetition. I played a lot of sports growing up, so repetition was the best way to get things down, find a routine and stuff. So writing things out, drawing out the diagrams, rewriting my notes. It takes a lot more time being a learner like that. But, once you get to dental school, you really got to kind of crack down and study because you're there for a little more serious of a reason. Getting into a balanced routine was something really important. Without that balance, it's really taxing on your mental health. It can be really exhausting without proper balance. So you got to make sure you got time to study, time to work out, exercise, and just time to hang out with your friends and really enjoy what you like to do. So if you're a person that likes to go out and hike or explore, go out on the town, it's something that you really want to try to find balance with. And then kind of the most important one for me was getting into study groups with people people that you're really comfortable with. I had kind of a broad range of guys. So some guys were really good with the clinical stuff. Some guys were really good with the didactic stuff. So, we get together and just talk, and we were all really good friends. So we go to the library, study at the study rooms in school. But all in all, we just kind of got together to really chat and learn from each other and see things from each other's perspectives. Let's see. Next thing. So community service. Oh, where am I going? Yeah, community service. So community service when you're applying for dental school is super, super important. Looks really good on the resume because it shows that, you care for other people. Our field that we're going into is in the medical field, the healthcare field. So it's literally just about helping other people. So if you show that you have that compassion, empathy, and whatnot for other people, it looks a lot better on your resume going forward. When I was in dental school, we had a lot of opportunities to volunteer. So I have a picture in the bottom right. This is from a dental mission trip we did to South Dakota. So we went to the Rosebud Reservation, and we did dental work for the Native Americans that were living on that reservation. We also had the Student Outreach Clinic, the SOC. It was a multidisciplinary student-run organization where we had dentistry, we had medicine, pharmacy, social work, law. So that was a great opportunity through the school. Some of you may have heard of Give Kids a Smile and Mission of Mercy. So those are two great ways to give back to the community. Give Kids a Smile is put on by pretty much every state. It's just an event where you get together, you do some screenings, some cleanings for the kids, play some games, and ultimately just educate families on proper oral health care. Mission of Mercy is a little more clinic-based. So you're doing fillings, you're doing extractions, root canals, really diet counseling, all the kinds of stuff that adult patients would need to take care of themselves. So all really good stuff. A lot of other schools have great opportunities for community service as well. So we'll move on to the next slide here. So choosing a specialty. This is a really interesting topic. So a lot of people go into dental school thinking that they're going to specialize. The motivator for most people, I would say, is kind of how much money each one makes, which is fine, nothing wrong with that. But what I've discovered is kind of as you go through school, you kind of see what you like about things, what you don't like about things. You kind of pick and choose what things you want to do. And ultimately, if your decision is to specialize, you're going to want to keep your grades up. Most specialty programs will look at your grades a lot. They'll look at your letters of recommendation pretty strongly. And then certain programs like ortho and oral surgery actually require you to take an exam first and get a test score. So I know the test score on that's pretty weighted as well. But ultimately what it comes down to is, how you interact with the people when you interview there. And basically it comes down to when they pick you with your match and whatnot. So it really helps to be well-rounded when you're trying to choose a specialty. You don't want to falter too much in one area, otherwise it makes it pretty hard to get into the programs you want. So I personally was considering, and I still kind of am considering, specializing as an endodontist, which is a root canal specialist. My reason for it was, I went into school thinking like I was just going to become a general dentist. I was going to graduate, I was going to come home, take over somebody's practice maybe, and start my own thing. But while I was in school at IU, I met the whole department of endodontics and graduate endodontics, and they were just the coolest people, super nice, really laid back, really made you feel like, like you belong there. And, ultimately that's what kind of influenced me to apply the first time around. I didn't have the greatest application because they really prefer you to do a GPR or have at least a couple years of experience out in the work or out in the field. So, it's not totally out of the decision. So I'm still contemplating, but yeah, it really does help to kind of see what each field does before you choose to specialize. Next one. So what is a typical day like? So question number one was, what are most patients concerned about? Most of the time when new patients come in, they're having some kind of pain or sensitivity. The younger crowd tends to care a little more about the looks of their teeth, so straightness and color, staining and whatnot. Sometimes they'll come in and say, I've got a cavity here, or this tooth is sore, or I think I need dentures, but ultimately it's up to you as a practitioner to look at them, do your assessments and kind of see what they need and really educate the patient. So what is the toughest part about proposing treatment plans? For me, usually the most difficult part is just getting them to understand why things need to get done. So I think educating the patient is extremely important. So in Latin, the word doctor means teacher. And, I think when we take that role seriously as a doctor, it's our job, because our patients don't go to dental school. They don't go to specific oral health education classes. So it's very important to teach them, proper oral health care, how to take care of their teeth, how to floss, how to brush, why cavities happen, why gum disease happens. Educating them is just as important as treating the disease and the problems. Preventative work is very, very, very important. If you care about your patients, you're going to want them to be on top of that and really take care of it. Otherwise, you're just going to see the same problems coming back again. And, once you really start working, you don't really want to see the same stuff coming back. So typical day for me, my first job is at a private practice. So I'm an associate dentist there. I was hired as an independent contractor, and that is pretty much the main office in there 3 days a week. So I start my day typically at 8 a.m. Kind of depends on my first patients coming in, but usually 8 a.m. I'll see anywhere from 3 to 5 patients in the morning. I can even see as low as 1 to 2, depending on the procedures. Lunch I take from 1 to 2, and then I'll see another 3 to 5 patients in the afternoon. Monday, Tuesday, I end around 5, and Wednesday I'll end at 7 p.m. So my procedures will range from doing cleanings to extracting teeth, root canals, doing CAD/CAM, kind of CEREC crowns and stuff. So the picture in the middle is actually a picture of the OmniCam, which is what we use for our CAD/CAM and CERECing and in-office crowns and all that good stuff. But at my job number 1, I work with no assistant, no hygienist, so it's just me doing everything. Job number 2, pretty much the same thing. So I'm there Thursday, Friday, or Friday, Saturday. I start around the same time, 8 a.m. Thursdays, I start at 9. So I'll see anywhere from 5 to 10 patients because there's hygienists there. So I do hygiene checks. I have more chairs there too, so I can kind of hop between chairs as well. Lunch is usually 12 to 1. Then I see another 5 to 10 patients in the afternoon and at 5 or 6, depending on the day. So yeah, pretty much the same kind of procedure. So root canals, fillings, extractions. No same day crowns there, so we're doing traditional impressions and everything. But over there, I work a lot quicker because I have an assistant to help me doing the suction, taking the x-rays. And then, like I said, we have the hygienists, so they're doing all the cleanings, and I just check at the end and do the exam. So this is my case number 1. If you guys follow me on Instagram, I just posted this case not too long ago. So the first one, this patient was in his mid-60s, no pre-existing medical conditions. Chief complaint was sensitivity to cold and pressure on tooth number 3, which is your upper right first molar. So my assessment of it, so we took an x-ray, I didn't see any kind of, any signs of infection in the tooth. On visual inspection, I don't know if you can see in the picture, but there's a nice fracture line running right down the middle of the tooth. And it actually goes through the amalgam, the silver filling itself. So that's usually a good sign that something's going on. So my assessment, I look at this filling and, there's not much tooth structure left. Once you take out the filling, the thing is going to be pretty hollowed out. So I knew already going in that it was probably going to need a crown or some type of full coverage for the tooth. So the tooth behind it, it looks a little beat up. So it is previously root canal treated. So that's what the big hole in the top is. It's a porcelain fused to metal crown. Some of the porcelain's chipped away. You can kind of see that towards the front of that back tooth. So it's not a great crown. So yeah, the treatment staging, so I did the exam, cleaning, x-rays and all that. And then the patient came in for the crown prep. So I do the local anesthesia. I prefer Articaine. If you guys are shadowing or you're kind of familiar with anesthetics, Articaine 4%, smaller molecule size, so it works a lot faster. The 4% is a higher concentration, and then you have epinephrine to keep it in the area. The rubber dam, so if you're looking at these pictures and you're like, what is this green thing on here? What in the world is this? Why does this person's mouth look like that? The green thing is a rubber dam. Rubber dam provides isolation, prevents things from falling to the back of the throat. A lot of stuff that you could get sued for malpractice over, it helps to prevent that. And ultimately, if you look at that bottom picture, the crown is not your traditional crown where you cut the whole tooth. It's basically what's called an overlay. And you're just covering the chewing surface and reestablishing the contacts in between the teeth. So you really need isolation to properly bond that thing into place, whereas the older crowns, you're just relying on retention to hold things together. So further stages. So in my prepping of this tooth, I took out the old filling, cut down the cusp, got everything out of the way. And then from there, I really assessed the tooth structure. So I didn't include the x-ray here, but on the back side of the tooth, on the distal, the amalgam went really, really deep. So if you look closely, there's a composite that I placed there for something called deep margin elevation. And what that does is it brings your margin up on the side of a tooth from below the gums to above the gums where it's more favorable to restore. very important to have isolation for that, because if you do it in a wet environment, good luck getting good bond strength. If you look toward the front of the tooth, which would be right about here, I don't know if you guys can see that, there's a little hole here from where I've tried to break down the crack. So the crack runs from the front of the tooth all the way into the back. And what I did is called a crack dissection. You try to get in between the enamel and the inner structure of the tooth called dentin, disrupt the crack, and infiltrate it with your resin material, and then you seal it up. So this is what it looks like when it's sealed. So the picture on the right. So immediate dentin sealing is a process used to seal your dentin tubules, increase your bond strength when you go to bond in your final restoration, and yeah, it just makes everything a lot more favorable. So in the bottom left here, the images, we have a scan of a tooth, not the same tooth in particular, but a scan that I've done before. The middle one is the milling process of the CEREC crown. And then the one on the right is your final overlay crown. It's an Emax material, porcelain, and the technical term is lithium disilicate. So it's a fancy kind of glass. So something important to look at when you're looking at this tooth, when I prep these overlay designs, I try to keep it really smooth, because essentially this Emax is just a piece of glass. And when you think of a piece of glass, if you lay it on a flat surface and you smash it, it's going to be really hard to break it. If you put it on a corner or an edge and you smash it, it'll be really easy to break. So I try to make my surfaces as uniform as I can. So here is the cementation process. So I place Teflon to the adjacent tooth to prevent it from sticking together. The little string is something called superfloss, and that's just there to make sure that the cement doesn't go in the gums. And I use heated restorative composite to cement these in place. The restorative composite just gives you a lot more working time than your traditional cements. And it's a lot more structurally stable once it's cured. So I clear the excess, polish the margins, and assess the bite, and call it good. Okay, so we're moving on to case number 2. So case number 2, if you follow me, I also posted it right before the last case. This one was pretty cool. So the patient is male in his mid-40s. Again, no pre-existing medical conditions. No pain or anything. His complaint was just, my crown broke off when I was eating a gummy bear. So he was hanging out with kids, eating their gummy bears, and snapped one of his crowns off. So this setup is a little more gnarly looking because I use a couple different types of clamps here. So assessment of the tooth, it's a lower right second premolar. So the one right before the molars there on the bottom. The x-ray I also forgot to include, but on the x-ray you can see that it's previously root canal treated. No presence of infection or anything like that. Bone height's normal, so it's got a decent prognosis. It's not the greatest thing out there, but we figured why not try it. So previous thing that was there was a porcelain fused metal crown, just like the last guy. There was a buildup in place, so dentists will often place these buildups to give more bulk for the crown to sit on. So the buildup came off with the crown, and yeah, so it wasn't looking fantastic. So I talked to the patient about this case, and I told him, worst case scenario, we can take this out and plan for restoring it with an implant. I know it's expensive, so I'm learning about this new type of procedure. So if you want to try it out, we'll give it a shot and I'll do it for free. So I think I talk about that on the next slide here. Yep. So free of charge, kind of an experimental procedure. So I try to do a type of dentistry called biomimetic dentistry. And it's just what the name sounds like, mimicking the natural structure, biomimetics. And it focuses a lot on adhesion techniques. So getting an adequate bond to your tooth with your restoration and kind of just putting things back how they were meant to be. So, the patient was down. He's like, let's give it a shot, man. Why not? So it does take a little bit more time to do things like this. So I told him if I can get a clamp and I can isolate this thing, then we can give it a shot and restore it. So I did my anesthesia. I used 2% lidocaine with 1 to 100,000 epi, and I did it via a right Gauge block. So Gauge block will get your inferior alveolar nerve, your long buccal, and your lingual nerve all in one shot. Real simple. It's not a comfortable shot, but patients are usually cool with it if you can nail it on the first try. So his whole lower right side's numb, super cool. Get the rubber dam on. So I clamp on the back tooth first, just to get the dam seated down. And then I clamp on the tooth stump afterwards to get proper isolation so you can see nice and sealed off on the edges. And we're ready to go. So first things first, any of the softer tooth structure I'll take off. The softer stuff doesn't usually bond too well, so I take it off with a handpiece. And then the rest of it, I hit it with it's called a micro etcher, but it's a form of air abrasion. And yeah, let's move on to the next step. So I do immediate dents and sealing, just like the last tooth. And then for this one, I covered up that little tooth stump with some Teflon tape, covered the adjacent teeth with Teflon tape to prevent them from sticking. And then I built this crown up by hand with restorative composite. So this whole crown right here is all handmade, and I polished it and everything and bonded into place with heated composite. So the reason I wanted to try to do this crown buildup with restorative composite indirectly, which means you fabricate it off of the tooth, it reduces the shrinkage. So when you set a composite with the blue light, these materials tend to shrink. So by doing it separately, you allow it to shrink, and then you can cement it in place. That puts a lot less stress on your bond, so you get more stable bonding to the tooth and more reliable and stronger bonds as well. So everything was cemented, locked this thing in. The guy's coming in next week, Tuesday, so I can take a look at it, and then we got another crown for him to get done as well. So I thought that was a super cool case. Pretty much made something out of nothing, and it did require a lot of different technique. So that's it for my cases, I believe. Yep, so there's our before and after. I should have did that for the last close, but it's okay. Yeah, so before and after, super cool. So my parting thoughts for this is, committing yourself to the dental field is a big decision. It takes up a lot of time, money, hard work, and dedication. It's not something you really want to get into if you're going to kind of be so-so about it. If you feel like you might back out, it's not something you want to get into. But the coolest part, I think this is super cool, is, it doesn't matter what you're going to school for. I've had classmates that were business majors. I've had classmates that were art majors. What else? I had hospitality, all kinds of different guys. So it doesn't matter what major you do, you just got to hit your prerequisites. It also does not matter where you went to college. Sometimes it does have a little bit of an influence, but for the most part, it doesn't matter. As long as you make the grades, you get your DAT scores done, and you do your shadowing, do some community service, and get good grades in school, you'll be fine. And it really doesn't matter how old you are. So the average age of my dental school class when we started was 26 or 27. I was the youngest guy in the class. I was 21. And I had classmates from anywhere from 22 to 40. I think the oldest guy was 43 when we started. So truly no limit on how old you can be. A couple of the guys had full careers before they went to dental school. One was a pilot. One was a dental sales rep. So really, it really doesn't matter what you've done or, what your degree is. Just get the scores, get the GPA. You should be good. So dentistry is just a super, super cool profession in the medical field. Really unique in the aspect that, we're taking things that are broken, fixing them, putting them back together with like essentially just fancy plastic. Super, super cool. And the impact we get to make on these people's lives is just amazing. You can literally put a smile on somebody's face and really make a positive change in their lives. So I think that's all I have. So we're gonna go to the Q&A.
Thank you. We've enjoyed your
Really
presentation. We have a couple questions, if that's all right.
Let's see.
Perfect. So one of the questions is, how long did it take you to adapt to studying for the dental school? Did you have to change your studying habits often?
So don't follow my example, but I only studied for the DAT maybe like a month and a half. I think if I studied a lot harder, I would have done a lot better on it. My scores were kind of weird. So my reading was really high. My PAT was really high, but my math was really low. But the calculator thing that they give you on the computer didn't work well. So yeah. But as far as studying, I would work. So I worked as a dental assistant when I was in college, and in between patients, and then when I got home, I would study. My boss was actually super cool. He bought me all my study materials. So he bought me the Kaplan study guide for DAT, and I would fly through that. And then he also got me a practice test for being a good employee, I guess. But yeah, so I would do the practice test and just kind of run through and figure out what types of questions they would ask and really study up like that.
Yeah. Perfect. Have you always wanted to go into dentistry, or did you change career paths?
So I always wanted to go into dentistry since I was like 5. It's super funny because I told my mom when I was 5 years old that I wanted to be a dentist, a lawyer, or a garbage truck driver. So only one of them really stuck. 2 of them made sense, one stuck. But yeah, so when I started to take it a lot more seriously, I was in high school. Right after my sophomore year, I decided to get into shadowing my family dentist. So I would do that over my breaks, just go in a couple days a week and just see how it works. And once I went to college, then he hired me as a assistant. So I would be able to sit chair side, do the suction. Here, assistants can take x-rays, take impressions, make the temporary crowns and all that. So he had me doing all that. So it was really, really cool experience. He also had his old typodonts. And so in between patients, sometimes he'd tell me, oh, drill this plastic tooth on my typodont, do this prep, and, fill it in. So it's a pretty unique experience.
Perfect. Another question is, how does the match system work for dental school?
So the match system, how that works is when you apply for your specialty program or your residency, basically you go into a pool of candidates. You go out for your interviews. You see what the program is like. You see how you like it. And then you rank the schools that the school or program that you want to match with. And you rank them 1 through whatever, how many you apply to. And they do the same thing. So they'll rank you. And if you guys kind of match up, that'll be like your first choice. And that's kind of how they pick you.
Perfect. Someone asked, what was your GPA in undergrad?
My undergrad GPA was a 3.54. So, not great, not bad. But I think what really pushed it over the top for me for my application was, the community service, the hours of shadowing, and I think to some extent my DET score as well. So yeah, I had a rough start in college. I went to Oregon State straight from Hawaii. Before going to school, I never even saw the school. I never visited Oregon. I didn't even know where my classes were. So it was kind of a tough time getting adjusted. So that really, really dinged my GPA from the start. And then the rest of my schooling, I was kind of just focused on building it back up.
Perfect. Someone asked, would you say that the work of a dentist on a daily basis is very strenuous compared to other fields?
Um, I think that kind of depends how you work. So, a lot of the strain comes from, our positioning, our posture, how many patients you want to see every day. So you can get to the point where you see a patient every half hour or so, and you're doing fillings in like 20 minutes. But then it comes to the issue where are you doing quality dentistry? Are you sitting the right way? Are you taking care of yourself too? Or are you doing all this stuff just trying to make all your money, and then you're kind of burning yourself out at the same time? For myself, certain days are harder than others, of course. You're going to be doing kind of strenuous things one day, the next day might be kind of cruise. So, things like tooth extractions, it can either be done in like 30 seconds, or, you might have to go in and section the tooth and it takes you like an hour to half an hour. So kind of just, your range of things you do, plus the way you do them, will kind of determine how strenuous it is on you. And then also just the self-care portion of it as well. So if all you're doing is working and you're not taking time to relax a little bit afterwards, or take some days off to really rest and enjoy life, then it's going to be really, really stressful and strenuous for you as well.
Perfect, thank you. Someone said, why did you not specialize? Or why did you choose general dentistry?
So I like general dentistry because I get to see my patients constantly. I really value that doctor-patient relationship that you get to establish. I thought it was super cool that, when you're the family dentist, the whole family comes to see you. They send you like Christmas cards, thank you letters and stuff. And, I really, growing up here in Hawaii, like I really learned to value family a lot more. So I think that's super cool. Plus, I think, the range of what we can do as general dentists is super sick too. So like one day, or like one procedure, I can be doing a same day crown, then I'll turn around and then do like an extraction or a root canal, and then jump into doing like a big old filling or something like that. It's like you're doing something different every day. So I kind of like that.
Perfect. Someone asked that earlier. I think you said you preferred 4% of articaine for procedures. Mm-hmm. Is there a reason why you use 2% in the dental case too?
So the case number 2, I didn't need as profound anesthesia. Certain studies were done, and they came to the conclusion that articaine was a little bit riskier for your lower blocks for some reason. So that's kind of a topic of discussion for a lot of dentists. So for some people, they don't care, they don't matter. Some people are like, oh, I never use articaine because, the risk of paresthesia, blah, blah, blah. For the most part, I kind of use them interchangeably. I didn't need the guy as numb because I was working on a non-vital tooth. Root canal means that, the nerve and the blood vessels are taken out of the tooth already. So I really just needed his gums to be numb, and that was kind of it. So I went with the 2% instead of the 4%.
Perfect. Someone asked, what is something that you struggled in dental school?
Something I struggled with in dental school. I think if you talk to any dental student, typically the second year of dental school is the hardest. You're kind of in between doing a lot of lab work classes. So like your fixed prosthodontics, so like your single crown, your bridges. Then you also get thrown in with your denture courses, couple other classes that you need to do a lot of lab work for. And then you're also tossed into all these classes where you have didactic stuff. So like oral pathology. We had our systems approach to biomedical science, or we call it SABS. We had our specialty didactic courses as well. So that's kind of the year that I really, really struggled, because you had to find like the perfect balance of how to do things. And, everybody was getting worn out. We're all getting super tired. And it's just kind of being able to push through that and, really dig deep and force yourself to study, when you're feeling tired, forcing yourself to take a break sometimes from studying to eat, rest a little bit. I think that was probably the most difficult thing that I struggled with.
Perfect. Another question is, how did you study for oral pathology? I heard that there's a lot of types of diseases, etc.
So oral pathology, I thought, was a super fun class. We had a fantastic doctor teaching us. So we had Dr. Edwards. He was initially at UMich, but we stole him, and he's awesome. But yeah, I think for me, just the way that he presented, I took notes really well for his class because, when you got a good teacher, you're a little bit more motivated to do better. So, I really took time to study for that class. We took in our SABS course, the Systems Approach to Biomedical Science, there was a lot of overlap with that too. Because we took a dermatology, what is it called? Yeah, dermatology module in that class. So a lot of overlap between the two. So, identifying the diseases based on appearance, histology slides, a ton of overlap. So it was really, really kind of made it a lot easier for us as students. And then having great professors, just really adds icing on the cake.
Perfect. A couple last questions. One is, any advice for individuals with low GPA but who really want to go to dental school?
So, you got a couple options with a low GPA. Work experience always looks good. The more experience you have, like shadowing and interning and stuff, the better your application will look. It doesn't hurt to go back and take a couple courses. I think if you redo it once and you kill it the next time, I think that looks good too. Really, the hard part is just getting to the interview, because once you're there, they kind of give you an opportunity to explain, because they'll look over your application and everything, and they'll ask you stuff like, oh, you got this grade here. What happened? Do you have any explanation for it? Or like, I see that you're kind of lacking here, but you did really well in this class, like any particular reason. So, prepping your interview skills also helps, because once you get there, you're going to want to be able to, talk to them about, kind of what you went through, what's happening. And, with a lower GPA as well, what they want to see is improvement. So if you're like me and you kind of started off in a rough patch, took some adjusting, but then, every semester, every quarter, your grades got better and better and better. That looks a lot better than, if it kind of goes up and down and fluctuates. They want to see something like Tesla stock and not like a Ford stock.
Yeah. Yes. Another question is, how do you cope with patient expectations? Can you tell us a little bit about one of your toughest cases or patients? So
patient expectation is, I should have put that as probably one of the hardest things about treatment. When we take our prosthodontics class, we talk about the different types of patients. So there's, the ones that kind of accept whatever and they're cool with whatever you do. There's kind of that in between where they kind of care, but they're okay with you doing your best. And then there's those patients that are what's called exacting. They really are particular about how things are. So when they're really, really difficult to work with, sometimes, something that my mentor would always tell me is just know when to refer. So if you're doing stuff like denture work on a patient that's already had a denture before, or someone that is really particular with how they want their stuff to look, there's either you got to go take a class to improve, or you got to refer them to a place that can meet their needs. I had a patient recently who I was doing some partial dentures for her, and she, like, in my head, I'm thinking, I want this thing to function well. I want this lady to chew because she had no back teeth. And when it comes to the day where I'm supposed to deliver it to her, she says, "Oh, I don't care how it works. I just care how it looks." And in my head, I'm like, with your particular case, you can't have both because it just wasn't an ideal situation. And so, I cut my losses and I pointed her in the right direction. I had her referred to a prosthodontist who's a specialist in making dentures and other prostheses. But yeah, I think for the most part, most people, when you talk to them and you really learn what they're about, and they're able to learn more about you as a practitioner, gaining the trust really helps with those harder to please patients. So when they see your skill improving, or they see that you really care about them, that really helps treatment go a lot better and smoother.
Perfect. Another question is, how's the relationship between the international trained dentists and the dental students who took the traditional pathway to dental school? Are classes different for both programs?
From my understanding, so Indiana University, we have our international dental program, so the IDP. So we would have 12 international students join our class halfway through the second year. So they're already supposed to be trained dentists in their home countries. We had a few from India, a couple from the Philippines, and I think a couple from South America. But yeah, so they're dentists in their home countries. And when they join the school, their first year is basically just doing all the lab work and stuff, and taking some didactic courses, kind of catching up, just should be refreshing for them, from stuff that they learned before. And then, once they join up with the current D2 class, the relationship kind of just depends on the personalities. So, I think every culture has their really nice people and their really not nice people. And, there's no sense of resentment between international and American students or anything. It's just more of like, if you're a jerk or if you're a nice guy. That's kind of what it came down to, at least for our class. And, we were fortunate where most of the jerks were just in our regular class and not in the international class. But yeah, I think ultimately, and what'll get you through dental school is just, looking out for other people, being a really nice person, and that gets you a long way.
Perfect. And a follow-up question for that is, what are some characteristics you see from those international trained dentists that made them stand out?
The ones that really stood out to me were the ones that you could tell that they were good at what they were doing. So I had a couple classmates that graduated from the Philippines, and they really took their education seriously when they were in school, and it showed when they did their work, showed when they spoke in class and answered questions, and it really showed when you did like group projects with them. Like they were smart and they were good at what they were doing. So that to me stands out more than bad work, because anybody can do bad work.
Perfect. And we have the last two questions. One being, would you say dentistry is flexible even when you don't own a practice?
I think it's still pretty flexible. It really does come down to where you end up working at. So my part-time job, I work at a corporate office, but so I always told myself in dental school, like, I was never going to work at a corporate office. I would never do that, blah, blah, blah. And so my wife's friends work for the corporate office, and they asked me if I wanted to work there. And I said, I really don't want to, but I'll interview just for the heck of it. And so I told my wife, like, my one stipulation, like, would be if I interview with them and they say, when you come in, run it however you want, like, do things how you want. we'll schedule whatever time you need. And I told her if they tell me that when I ask them about it, then I'll probably work there. It's fine. So really, it does depend on where you're working, because if they're willing to accommodate, how long you want for things, what kind of materials you want to use, then it ends up being a really flexible practice, and you can really thrive how you want to. Certain offices, my friend was working for an Aspen Dental in Chicago, and they really tried to push his production. So we were just talking about this yesterday, but he was talking about, he would look at his schedule one night, come back the next day, it's completely different, and they'll like double, triple book him. So he's working hard, sweating every day. And for him, it wasn't flexible because they only had a set amount of things that they did, set amount of things that they used. And when he would ask for different things, they just straight tell him, nope. So yeah, what office you work in and what kind of office you work in really does matter as far as flexibility goes, if you're not going to own the practice.
Perfect. And one last question. Is there something you wish you had done differently after you graduated dental school?
That's a good question. Something I would have done differently. I think what I would have done differently is explore the job market a little bit more. So right now, my main office, I work with my uncle, and he's my dad's cousin. But I don't know. My dad was just like, "Oh, go work for him because he's gonna offer you a job, and it's like a guarantee." But now looking back, I had one other job offer, and he was offering, a lot of different stuff and a really good salary. But I told the guy like, "Oh, no, I think I'm gonna work with my uncle." But that, I think if I could do it over again, I would explore a little more what's out there, see what other kind of opportunities are available. So now coming up, I'm kind of looking into maybe partnering up into some kind of other practice where I can, have some ownership of the office that I'm working at. But yeah, I think that would have been cool, would be to just look around a little more and see what other offices were hiring, what else was out there. But, so far I have no real regrets. I just think it would have been cool to see other offices and stuff.
Perfect. Thank you so much for joining us today. We learned a lot about dentistry, so we appreciate it a lot. Thank you everyone for joining us for today's session. Just a reminder that in order to get your hours, you'll have to get a 3 out of 5 on the quiz, which is located in our Instagram bio. Thank you, Dr. Oka, for today's session.
You're very welcome. Thank you for having me.